Hi, I'm Dr. Puneet Gupta. I'm a neurologist here at Neurology Consultants of Dallas, better known as NCD. I'm one of the epileptologists here in the group, and I became an epilepsy specialist for a really personal reason. When I was a little boy, growing up, my mom developed epilepsy, and I saw what it could do to a person and their livelihood and their family, and I wanted to bring that personal experience to my practice and to really better care for patients and their families. We've seen what medications and their side effects can do, and as a physician, just asking about seizure frequency is just the tip of the iceberg. And I thought there was more to caring for a patient than seizure control. I was practicing in academics for a little while, and when I was looking for an independent practice, I really was looking for a group that cared for patients in the inpatient realm as well as outpatient realm, because epilepsy can lead into acute crises where you need inpatient care, and NCD was virtually one of the only practices that did that, and it wasn't out of a need of necessity. It was actually one thing that they really wanted to do to elevate the quality of care for their patients.
Hi, I'm Dr. Fonda Chen. I joined NCD in 2018. People ask me why I became an epilepsy doctor, and I find it difficult to explain without sharing with you my own story. Most of you probably won't notice, but I live with a chronic illness since birth. I was so sick at one point I could hardly get myself out of bed. Then I was lucky enough to find a great doctor and got my health back on track. And after that happened, I found myself doing things that I never thought I could achieve before. And for that, I felt so lucky, and I'm eternally grateful. The reason why I'm sharing that story with you is to let you know that I understand how easy it is for us to let a chronic illness dominate our lives. And I want to say, don't give up and don't settle. I feel that my own experience with dealing with a chronic illness shaped the way I approach my patients. There's really no one best way to deal with each individual situations. There are medical opinions and suggestions, but there are also things that are practical and reasonable for each patient in their own situations. I believe in finding that sweet spot for each of my patients so that epilepsy is not what defines them. My hope for my patients is that they will gain the freedom that they need to focus on what's important and enjoyable in life. I feel that by being in the NCD family, I can achieve that.
Hi, I'm Dr. Deepa Panjeti, and I'm so excited to be joining the family here at NCD. I became an epilepsy doctor because I find epilepsy very fascinating and interesting, but also because we have so many treatment options available now, including surgery. And I knew that I wanted to join a practice that was able to offer everything to our patients. And one of the most rewarding aspects of my job is taking care of my patients. Epilepsy affects all aspects of someone's life, and I think it's very important to acknowledge this and really take care of the whole person and make sure that what's important to them is relevant to the treatment and care that we provide for them. And I think I can do all of these things at NCD.